Welcome back to the Physio Foundations podcast, where we discuss the knowledge and skills that provide the foundation of expert clinical practice. So this is part 2 of a 4-part series on qualitative research and how you can apply qualitative research in the clinic as a student or as a clinician with Dr. Melanie Farlie. So if you haven't listened to part 1, that's okay. We've designed these in a way that you can listen to them in order, or you can listen to one at a time. If you want an introduction to Mel and her background, go back and listen to part 1. But for now, Dr. Melanie Farlie, welcome back to Physio Foundations.
Hi, Luke. Thanks for having me back.
Always good to chat to you. We always have very interesting conversations. So let's briefly recap part 1 and then dive into an example relevant to physiotherapy practice for this episode. So in part 1, we sort of dived into the basics of qualitative research and the importance to clinicians and its significance in physiotherapy. So we talked about how qualitative research can help us understand the human experience and behaviours that shape how people engage with physiotherapy. We talked about how we as therapists interact with our patients and how we apply evidence in practice, and how qualitative research can give us deeper insights into the why behind human and patient behaviours and give us a richer perspective on the human side of healthcare. And then we compared qualitative and quantitative research, and it was quite some good answers from you there, and it was quite clear to me when I was listening to that how qualitative research really complements what quantitative research does. And you made the points that quantitative research focuses on numbers and measurable data, whereas qualitative research is more concerned with understanding the why and the how with non-numerical data, like interviews or observations. And what else did we discuss in part 1?
Yeah, we also talked about why some physios might hesitate to engage with qualitative research. And we sort of talked about where terminology might be unfamiliar, or if, people might think that the qualitative research is less rigorous. And so we highlighted how understanding qualitative research can really enhance our understanding of healthcare and play a part in informing our clinical reasoning. And we also covered some of the more common terms that you might find in qualitative research related to physio, like what is coding and what are themes. And we talked a little bit about reflexivity and bias and the idea of transferability, and how these terms can be sort of important things to understand when looking at qualitative research, because it helps us to evaluate the quality of the research that we're reading. And last, we sort of talked about practical ways to get started in qualitative research, such as reading well-written qualitative studies, and we're going to have a look at one of those studies today.
Let's do that now. So what's your example qualitative study that we can dive into?
Yeah, absolutely. So I come from an orthogeriatric physiotherapy background, so I'm quite interested in how people experience rehabilitation. And so I want to share a study that I recently worked on that was published earlier in 2024 in Disability and Rehabilitation. And it uses a participant quote in the title, which can be common in qualitative studies. And so this one was called, "I'm still in the lap of the gods. I don't know whether I'm going to improve or not." And so this was a study led by Dr. Catherine Lawler and a team from various institutions around Australia, and focused on listening to people with dementia or cognitive impairment, along with their support people, about the experiences in inpatient rehabilitation. And so this study really tried to emphasise the importance of incorporating the voices of people with dementia and cognitive impairment, as their perspectives are often underrepresented or overlooked in research, in particularly inpatient rehabilitation settings. And if you sort of think about a lot of quantitative research studies, or just research studies in general, an exclusion criteria can be that the person has a cognitive impairment. So they're often excluded from studies. And so this project tried to look at what we could learn from the insights and experiences and preferences and needs of this particular group in our healthcare system.
So a really important topic. So what were the research questions that came from that topic. And a related question, why is qualitative research the best way to answer those questions?
Yeah, so this study had two main research questions. So the first question was, what were the experiences of people with dementia or cognitive impairment and their support people when participating in inpatient rehabilitation? So if we think about what we talked about in episode 1, the qualitative research is something that is really an approach that you're using when you're trying to understand human experiences. And so this was about an exploration of how people with dementia or cognitive impairment and their support people in this rehabilitation experience, what it was like from their perspective. We also had a second question, which was how might inpatient rehabilitation units improve access and outcomes for people with dementia and cognitive impairment, because we wanted to take these qualitative findings and apply them back to clinical practice to see what we can do to help support people with dementia and cognitive impairment who are in rehabilitation, as well as their support persons, to really have some information that can help us look at our practices from their perspective.
So it's really quite practical, taking that information, and you can feed that back in and give people a rich source of information. If you flip it back the other way, if you'd tried to do this study and ask those questions with a quantitative approach, what would you missed out on?
I think what you might have missed out on is the aspects of human behavior that are very hard to reduce down to numbers. So it's really difficult to sort of put a numerical value on human experience. And so that's what the qualitative study is able to do, is to sort of look at that human experience. But remember also that the researcher is involved in the qualitative research process, whereas with the quantitative perspective, the researcher tries to remain removed from the process. And so that's quite different to what we were trying to achieve with this project.
And there's advantages of that, of you being involved in it and adding to the richness of that data.
Exactly.
Talk us through the methods in that study. And this is similar to the question I asked you in the first episode, where we went into the terminology and tried to if people were a little bit afraid of reading that study, a little bit scared off by some of the terminology, you defined that really clearly. So now we can go ahead and read those studies and have a better idea of how and why they were done. Talk us through the methods that they used and break it down for us.
Yeah, this study, like, we'll sort of bring in a new term here. So this study used what we call an interpretivist approach. And so what that means is that the research approach is about the relationship between the participant and the researcher, that is like a partnership. So the researcher is not just observing the participants in the study, they are actually interacting closely with the participants and the broader research team sort of interacting with each other around interpreting the data and the analysis to try and understand the experience and perspectives of the participants in the study. So when a researcher is doing interpretivist research, they listen to what the participant has to say. They ask open-ended questions to allow the participant to share whatever their experience might be, and really respecting those participants' viewpoints, not challenging them, but sort of listening to what they have to say. And then the researcher also is recognising that how their background and beliefs and values can influence the research. This is the reflexivity part of it that we talked about in the first episode. And so the researcher, by saying they're using this interpretivist approach, is aiming to be transparent about the fact that they are open about the fact that they are influencing the analysis and what the findings are. And so the goal really is to sort of co-create research knowledge with the participants and using the participants' voices and stories as a central part of that. And so this paper sort of one of the ways I did that was to use sort of the words of one of the participants in the title of the study.
Isn't that exactly what you do when you're working with a patient, doing an initial interview or a podcast interview right now, we would have a different interview if you had a different host.
Yes.
And
Yeah.
that's a part of it.
Yeah, exactly. And the idea that that there are different people would interpret things differently. And so in qualitative research, it's often done in teams, particularly with, like, this was a team of academic research physios and clinicians that all work together to collect the data and analyze the data. And so in this paper, if you're interested, there is sort of a team reflexivity statement which talks about how all the different members of the team, where they came from, and their perspectives coming into the research, and how their perspectives influenced what they were, what they were putting into the research and what they were taking out in the way of interpretation.
And I'll add the link to the paper in the show notes for people who want to go and read further into it.
Yeah.
Really interesting. So talk about how the data was collected and analysed, and we can link back to that first episode where you explained some of those concepts as well. And really, let's really make it clear to everyone how this differs from a quantitative study. So what methods were used, and how was the data collected and analysed, rather?
Yeah. So the data in this study was collected using semi-structured interviews. So there was 10 people with dementia or cognitive impairment that were currently in inpatient rehabilitation, and then their support person. So there was 9 support persons from memory, and the data was analysed using a method called framework analysis. And so framework analysis is one qualitative approach, and in this study we use the framework analysis to code the data to understand the participants' experience of being in rehabilitation, and where possible we used the participants' language and terms to create these codes of what the experiences were like. And then we went through a process of looking at all of those different experiences that had been communicated to the research team, and then looked at themes that helped us interpret the findings in a way that was relevant to clinical practice. And so we used a computer program called In Vivo as part of this process, and that's a qualitative data analysis software program that just helps you work with things like interview transcripts and do this sort of organising and pattern finding and creation of both codes and themes in a structured way.
So this framework and the findings, they grow organically, and there's no way of telling what your findings will be. Do you talk about hypotheses in qualitative research? Well, that's a quantitative research word.
Yeah, so a hypothesis is more about something that you would use in an experiment to either prove or disprove. Whereas in qualitative research, we're really looking to either explore or understand a particular phenomenon and then explain it rather than prove or disprove it.
And those words are important because they help you define really your question and which direction you're facing in.
Yeah. And I think it's also one thing that we do in our qualitative research is really sort of talk about the context that we're asking the questions in as well, because the context can matter. So even the fact that this was a study that was conducted in inpatient rehabilitation in an Australian hospital will mean that there will be certain things that are not transferable to other inpatient rehabilitation settings because the system might be set up differently to the way it's set up in Australia. So that's something about qualitative research is really important, that the researchers communicate the context of the study so that then you can, when you're reading it, you can sort of see whether or not that context may or may not apply to your particular research setting, where your practice setting where you're trying to implement the research.
Yeah. So it wasn't generalizability from memory, it was transferability.
No, transferability, correct.
So it may not necessarily be transferable, but when it is, it can be a really rich
Yeah.
really interesting form of data that you can get, and you can help inform what you do.
Yeah. And I think it's sort of, there's various aspects to the transferability. So there might be findings that are transferable to physiotherapy settings where you're working with people with dementia and cognitive impairment, for example, and their support persons, or there might be things that are transferable to other inpatient rehabilitation settings more broadly. So understanding the context and then picking out what might be relevant to where you're practicing is an important part of reading qualitative research.
Okay, so that's the how then, and let's go back to the what. So what were the findings of this study and how they're relevant for physiotherapy practice, but maybe specifically how were they relevant for this healthcare setting? How would they use these findings and transfer these findings?
Yeah, so the findings of this study really highlighted some key areas that we can focus on for improving rehabilitation experiences. And so some of these things were things like supporting engagement, so working with people with dementia or cognitive impairment to help them engage. And so part of that was talking and working with support persons to understand what things might help the person, support the person to engage in the rehabilitation program. Another thing that was really strong was this idea of hospitality, that a big part of making any healthcare experience better for people is this idea of kindness and care and service. And, you know, it's not just the therapy that's provided, it's the way that we approach people with respect and kindness and these sort of elements of hospitality. And then, as I've said, really understanding the role of the support persons and ensuring that staff have adequate knowledge about dementia and cognitive impairment were really the main findings of this study. So they're really relevant for physiotherapists and other healthcare professionals working in geriatric rehabilitation settings, where understanding and addressing these factors might enhance that healthcare experience.
And given those broad findings, they may well be relevant to people in non-clinical roles, leadership, thinking about the broader leadership of the hospital, for example, and the culture. And as you said, the word hospitality and the origins, hinted to the origins of where that word hospital comes from. So really interesting.
Yes. Yeah, absolutely. And I think like this idea of kindness in healthcare is not just applicable to this particular setting. Like that idea of kindness in healthcare is something that we've been talking about for some time. And as we, as pressures on service and pressures on resources grow, sometimes that kindness can fall away. And so I think that's something that, no matter where you are or who you are or who you're working with, always sort of pausing and taking a moment to think, how to be kind in this particular interaction is a really key part of delivering good care and good healthcare.
Very well said. So in part 3, Mel, we're going to be talking about the quality of qualitative research. Yes. So how to find high quality qualitative research, where to look, how to know quickly whether this is a high quality study that you should be reading, but importantly, how you can evaluate how useful this will be for you, which you've touched on a little bit there with that example. So looking forward to it.
Yeah. I think that, not everyone's going to be working in orthogeriatric rehabilitation. But we'll talk about how you might be able to find qualitative research that could be relevant to your clinical practice area, whatever that might be. So I'm looking forward to talking about that with you in the next episode.
Well, you're someone with many decades of experience in orthogeriatric rehabilitation. So why not do that example? And it was a really good example as well. It doesn't have to always, physio podcasts don't always have to be about ACLs and tendinopathy. And I think that was a really good opportunity to explore that area. Yeah, so
Thanks.
fantastic. So everyone, you go back to the last episode if you want to find our Twitter handles and everything. You can find them in the show notes. I'd probably look up that study if you want to have a look at the details of that and try to apply what Mel was saying to an example. And then as we go through the next two parts of the series, we're going to be thinking about a little bit more specifics of the quality of the research and then more application to practice. So I'm looking forward to it. Thanks very much again, Mel, for your
Great.
time.
Thanks, Luke.
So until next time, this is Mel and Luke wishing you all the very best with your studying, professional development, and lifelong learning.